Hello, PW families, and welcome back to our monthly caregiver training series. This month, I decided to focus on de-escalation strategies. I know with summer coming, that means that typically you're home more with your kiddos and they're not at school anymore, and chance for escalation increases. So I figured this would be a good time to talk about how to manage that. So first, let's talk about what an escalation is. An escalation is a heightened state of behavior which usually results in the increase in intensity and severity of that behavior. What do escalations look like? Honestly, they can look very different and they're very child specific, but escalations can look very different for every child, but I wanted to list out some common behaviors that we see in escalations here, and that is often crying, screaming, kicking, or hitting, which we call aggression, and you might see that on your session summary form sometimes. Throwing items or breaking things, we label that property destruction, if you ever see that on your session summaries, and elopement, which is fleeing an area or even the building without prior adult permission. So what do we do about escalations? First, we should always try antecedent strategies. Of course, we want to set the child up for success as much as possible, and antecedent strategies help us prevent escalations. So it's important to set your child up for success by developing these tools that are antecedent strategies. And this isn't an all-encompassing list, but some examples of common antecedent strategies that we use with a lot of kiddos are reinforcement schedules. So this is reinforcing the behavior that you want to see continue, the more appropriate behavior, and that hopefully antecedently motivates them to want to do the more appropriate behavior opposed to have an escalation. Visual schedules. This can help them prepare for what's next if transitions are challenging. Forced choice. This can be helpful if control is an issue. It gives them a false sense of control. So that would be, do you want a banana or strawberries instead of do you want snack? It's more specific, makes them feel like they get to choose, but you get to pre-select the options. First then boards. This also helps with transitions, and it's a good first step if your child's maybe not ready for a visual schedule yet. It's a little less visually overwhelming, but is another great transition tool. Timers, also a great transition tool if your kiddo needs a little extra time or just needs to be prepared for a transition. Sometimes that can help avoid or prevent a tantrum when transitioning away, especially from really preferred activities. Social stories can be great, especially if your child has anxiety around new activities that they'll be trying or a schedule change. They can help talk through what to expect, and that can help prevent escalations when the time comes. Non-contingent praise is also something that we do a lot of. That's just providing your attention non-contingently and before a behavior occurs so that they're not engaging in behaviors to get your attention. So these are just a general list of some common antecedent strategies that we use to help prevent an escalation from occurring in the first place. But the downside of antecedent strategies is they're not a guarantee. They don't always work. Antecedent strategies definitely don't work 100% of the time. It is common to have to change antecedent strategies as your child grows and changes. Some kids, I'm changing them bi-weekly. Other kids, they work, year after year. It just depends on your kiddo, but it's definitely not uncommon for antecedent strategies to need to be changed or tweaked in order to continue to be successful. Sometimes the function of the behavior changes. Maybe they were hitting for attention, but now you have a replacement behavior for that. So they've started hitting to get access to dessert. Or they've become satiated on their reinforcement schedule. And I would say that this is probably the most common thing that we see is kids get tired of their same reinforcer, or we might need to increase the reinforcement for a while due to maybe a setting event. antecedent strategies are fluid and do need to be changed. So once we have found ones that work, it doesn't mean that they're always going to work. If you notice your child's antecedent strategies aren't as successful in preventing escalations as they used to be, reach out to your child's BCBA and ask for help. We definitely want to know when they're not working. But something I will say is that, setting events happen, environmental changes happen, and, we all have bad days. So if they haven't been working for at least 2 weeks, then let us know. But if it's just been a tough week, we might not want to make a change immediately. We might want to make sure that it's really the antecedent strategies that are failing and not because, school's starting back up again or they saw dad over the weekend, some kind of new environment change. But yes, definitely let us know if your antecedent strategies start to fail you. What do you do if the antecedent strategies did not prevent the escalation? So you've tried all of your tools in your tool belt, and your child still escalates, and it happens, and that's okay. This is when we really need to learn our de-escalation strategies and when they come in handy. So what is de-escalation? De-escalation is a set of conflict resolution strategies for when a child is already in a heightened state. So these are the strategies that we're using at the first sign of an escalation to hopefully prevent it from reaching its most severe and intense state. What are some de-escalation tools that we use in ABA? Again, this is not an all-encompassing list, but I do feel like these are probably some of the most common things that we use consistently across most children. And that is break spaces, giving them a safe space for them to calm their body, coping skills, giving them tools for them to learn to help them independently de-escalate themselves, prompt a more appropriate replacement behavior, give personal space, being aware of your physical proximity to them during an escalation can be really important in de-escalating a child, and definitely remaining neutral in your body language and your tone of voice. So, break spaces. Break spaces are used for when the child is unable to de-escalate around others due to attention-maintained behavior. So if a kiddo is escalating in the motor room when there's lots of other kids around playing, there's a lot of opportunity for them to get a reaction if they're escalated. And so we might prompt them to go take a break so that they can calm down faster since the attention would be removed. Break spaces are also used when safety is of concern, so the child can be alone to calm their body down and won't have access to others or anything that could hurt themselves, especially. So this is common if we're seeing severe aggression or property destruction, throwing items at people. This is for those really intense moments where safety is our number one concern and other people's safety is at risk, or that child's safety is at risk who's escalating. And so we need to get them into a break space where they can be safe and calm their own body down and not hurt themselves or anyone else. And for some kids, the term break is aversive. So we've had to get creative in the past with calling it different things. And these are just some examples of other phrases I've used in the past with clients who really hated the word go take a break or break space. And so we've used chill time, like go have some chill time. Some of my teenagers really prefer that. It just sounds cooler. Alone time. Or quiet time. All of those have been used in replace of break space, and you could really call it whatever you want. The goal is we want the child to want to go take a break when they're frustrated, and so we don't want it to be an aversive thing. So if breaks to them is aversive, we want to change that mindset around it. How to create a break space in your own home. So consult with your child's BCBA. These break spaces should really be child-specific and definitely individualized to meet your family's needs. I mean, every family's home is different. Every families' like sleeping and living situation is different. So whatever you guys need in order to create an appropriate break space is probably going to be really individualized, and dependent on your child's behaviors and what you guys see at home, and if there's aggression involved. All of those things are things that we would have to take into consideration when we're talking about creating a break space. But I did want to come up with some general guidelines that we typically follow when we're developing break spaces with families. We like to make sure that there is definitely nothing in the break space that the child can break or damage that is important or of value to you, because it's most likely not safe for you to go in when they're already in there de-escalating to grab it. So we really want to sanitize the environment first and just make sure that there's nothing in there that they could break and hurt themselves with, or that there's something of value to you. We also want to make sure that if aggression towards others is a concern, towards siblings, towards mom, towards grandma, whoever, we want to make sure that this space is a place where they can be safely left alone. It's definitely not safe if severe aggression is of concern during your child's escalations. It's not safe to have other people in that space with them at that time. So we need to make sure that that break space is free of anything that they could hurt themselves with or hurt others with, and that they don't have access to anyone else's bodies while they're escalated. We also want it to be safe but also calming. So some things families have used in the past are music, special lighting. I've got some kids that have lava lamps or some string lights, something to just make it a place where they want to go to. Like I said, we don't want breaks to be aversive. We want it to be a space where they feel that they can safely take themselves to when they need it eventually. That definitely takes some teaching and training and practice, but that's the end all be all goal, is that this is a space they want to go to when they're feeling this way, and that it does help them calm their bodies down. And so music, special lighting, weighted blankets can be really, really helpful. Bean bags, I've seen kids use gym mats before. Anything that makes it comfy, cozy, and helps calm their body down is totally fine, as long as it's safe. So coping skills. Coping skills are specific methods or strategies that we teach children to help them calm themselves down when beginning to escalate. So I think kind of the goal with coping skills is independent de-escalation. So coping skills must be taught when the child is already in a calm state. I think we all can relate to this, that it is challenging to learn a new thing when you're already really frustrated. I know I definitely am not in the right mindset to learn when I'm feeling frustrated. So we can't expect the children to be willing to learn when they're frustrated. So we always start by teaching coping skills when they are in a completely calm, happy state and are willing to receive information. Coping skills need to be child specific. Taking deep breaths doesn't work for everyone. I mean, I think this is probably one of the most important things to talk about, is that, whatever works for your child is okay. I have a client who needs to watch a few minutes of a show and take a bath to calm himself down, and that's totally appropriate because he's a teenager and that's functional for him and it works, and it's something he's willing to do independently. Now obviously that's not something that would work for everyone, but it's important that it's child specific and that it actually is something that helps de-escalate them. If they take 5 breaths and then they're still screaming at you, that's probably not a super effective coping skill. So I think finding what actually works and what actually calms their body down is really important, and it's not the same for every kid. Coping skills also should be age appropriate and or developmentally appropriate. So like I said, the teenager, he does a bath and maybe a few minutes of Netflix, and that's totally developmentally and age appropriate for him. Would that be age appropriate for a 5-year-old client? Maybe not. I don't know. It depends. But it needs to be something that is definitely considered when you're choosing coping skills. Common coping skills that we teach at the clinic are, and again, this isn't an end all be all list. Sometimes they're very specific to the child, but these are some that we've taught in the past that are pretty common. Taking deep breaths, when we're teaching little kids, sometimes it's helpful to use the terminology of smell the flower and blow out the candles so they can understand how to take a deep breath, counting to 10, choosing a different activity. If one specific activity is really frustrating them and you're starting to see some antecedents to an escalation, say, hey, maybe we should try switching from dolls to Legos, and we won't have to be as frustrated. Asking for help, asking for a break, or independently learning to take a break. Taking a bath or a shower, squeezing your hands together, or a stuffed animal, a squishy toy, whatever works for them. Going for a walk can also be helpful if the child is not an elopement risk or can be trusted appropriately to go for a walk and calm themselves down. Prompting replacement behaviors. So for this to work, you really need to have a good understanding of the function of your child's behavior. It's not going to be effective if you're prompting them to do something that's not serving the same function as why they're escalated. So, for example, if they hit you on the arm when you know they need help opening their chips, you could immediately prompt, you could say, I need help. And once the child says, I need help, then you can honor that request and open the chips. This would only work if the function is access to a tangible. Another example is if your child is climbing on you to get your attention, you can immediately prompt, excuse me, mom, and give attention when they say, excuse me, mom. This would work if the function is attention seeking. By immediately prompting the more appropriate behavior, you can interrupt the escalation process while also reinforcing the more appropriate behavior. So it's kind of a win-win, and something that we definitely do a lot of here at ABA. So why is it important to give personal space during an escalation? I think sometimes as caregivers and just people who love and want to care for children, when you see a child who's escalated, you want to just jump in and help and, help relieve the situation. But sometimes that's actually one of the worst things you could do. It's just really situation specific, but I think it's good to talk about because I think it's kind of the almost the opposite reaction that you would maybe expect us to tell you to do. So I think if aggression and or property destruction is a concern during an escalation, it is important to remain a safe distance away from the child as long as they are not a harm to themselves. There's no reason to stand within a foot of your child while he's kicking and hitting you, screaming, because it's hurting your body, and you can just step a few feet away and keep that safe distance, if at all possible, especially if they're not harming themselves. If they're harming themselves, then that's a whole different conversation, and self-harm is a scary and delicate behavior to handle. And if your child does engage in self-harm behaviors, I really encourage you to reach out to your child's BCBA and develop a very specific individualized behavior plan, because that is a different situation for sure. But if aggression or property destruction is a concern, I would say keep a safe distance away from the child as long as they're not a harm to themselves. It is also important to give personal space for some children if bringing attention to the escalation increases the severity and intensity of the behaviors. Sometimes even just being within like a physical proximity to the child can make them feel like they're getting a reaction out of you or a rise out of you. So sometimes walking away is honestly the best answer. We definitely aren't trying to increase the escalation, we're trying to decrease it. So if you being nearby is escalating it, then walk away, if at all possible. Physical proximity can also increase a child's anxiety during an escalation and may make the escalation worse. Sometimes being too close to them when they're feeling frustrated can make them feel embarrassed, can make them feel anxious, and just spirals and can really increase the escalation. So being aware of that and knowing physical proximity does affect your child and that you can remove it, that is a great and easy tool to start using right now. Like I said, though, this is definitely not the case for every child. Some children want to be comforted, some children aren't affected by physical proximity, but it is something to be aware of and maybe think about, like, am I too close when my child's escalating? Is that making things worse? Maybe I should try to, give some more personal space when he's feeling frustrated. But it's just something to be aware of. Remaining neutral. This is so important, and I know so challenging to do, especially if you're the target of an escalation. But it is very important to remain neutral when a child is escalated. We don't ever want to pair our reaction with the behavior. And yes, even negative attention can be reinforcing. So we don't want to show our children that, they're quote unquote getting a rise out of us, or that we're frustrated, because then they might pair that as negative attention and we might accidentally be reinforcing the behavior. Having a neutral tone of voice and body language can also really help de-escalate the child, because it helps create a more calm environment. If you show your frustration or raise your voice, this can increase the intensity and severity of the behavior, and that's definitely not what we're trying to do. Remember that escalations are not a teaching moment, that when a child is escalated, that they aren't receiving in information, and that's why we teach coping skills when they're already calm. Same for when teaching that's appropriate or that's not safe. During the escalation is probably not the time where they're actually even going to receive that input and learn something. It's probably better to debrief about it after, or just teach replacement behaviors once they're calm. Remember, calming down is not easy for the child, and this is a skill they are still learning. It is difficult to use a new developing skill in the moment while escalated. I think that would be difficult for anyone. So if you can kind of tell yourself that in the middle of the escalation, maybe it will help you remain neutral, that this is still something that they're learning and struggling with. If you need to take a break when your child is escalated, that is okay. That is awesome that you can recognize that. Being the target of an escalation can be physically exhausting and mentally draining, especially if you're having to deal with it day in and day out. My hat's off to you. That is so challenging, and it's okay that if you need a break. It is 100% okay. If you're having a difficult time remaining neutral, walk away and take a break. This is great modeling for the child of an appropriate coping skill. So you are showing them that mom needs a break and is going to go take a break so that she can calm herself down. I think that's totally appropriate, and I know that might not always be safe or an option, and if that isn't, I really recommend you to reach out to your child's BCBA, because you do need to have that option. So we need to find a way to be able to have you safely walk away if you're feeling overwhelmed and you just need to take a step back. Any questions? If you have any questions, please feel free to email me. My email is jalen@pacificnorthwestautism.com. If you want any help applying these de-escalation strategies to your home, let your child's BCBA or myself know. We would be happy to create a break space, develop some coping skills to teach, or even coaching you through how to walk away if you need to. We're here for whatever you need, whatever de-escalation purposes you need, and what your family needs. And always remember that you are doing a great job.